After a mastectomy, breasts can be reconstructed with either implants or the patient's own body tissue. Here to discuss both options is Dr. Desiree D'Angelo, breast surgeon with Premier Surgical Network in Ann Arbor Township. First, let's talk about breast implants.
So typically after a patient has a mastectomy, the most common reconstruction that we do is with a breast implant, something similar to something like this, which is a silicone implant. They are placed underneath the skin and usually on top of the muscle now, where in the past they used to be placed underneath the pec muscle.
And patients tolerate them well?
Yes, they do. They can sometimes complain about the weight of them because they can be a little bit on the heavier side, but usually they get used to them and have no complaints afterward.
And what about reconstructive surgery?
So with mastectomy, there's different options for reconstruction where we can use tissue. The patient has to have enough body tissue, though, to support a breast mound. So you have to have enough of that abdominal tissue or tissue on the side, which is called a latissimus flap, that can be used to make a breast mound.
How successful is that surgery?
They're very successful. The tissue reconstructive surgeries are a longer recovery time. Where you may be weeks of recovery, where an implant reconstruction is usually a quicker recovery.
And you work with your plastic surgeons in your group?
Yes.
Yeah.
So we typically do our cancer surgeries together, where we're planning and prepping the breast for reconstruction at the same time as we're removing the cancer.
So that really is a benefit to the patient.
Absolutely.
Everything's all in one, and
Yes.
you talk and you work as a team.
Yes, absolutely.
Where can people learn more?
At our website at premiersurgicalnetwork.com.
Thanks so much, Desiree D'Angelo of Premier Surgical Network.